Now we will start with the next session, and we will start with a presentation by Dr. Monica Alonso. She will share with us about the challenges in combination of HIV prevention in the context of a pandemic in Latin America and the Caribbean. Dr. Monica Alonso is a PhD, physician with the Universidad Complutense de Madrid, public health degree, sanitary health, and she completed her PhD in the epidemiology field. She has performed the last 16 years of her profession in the Pan American Health Organization as a regional advisor of HIV and viral hepatitis. She has led the production of reports that probably all of us have read and we have heard about them, about the high impact for Latin America and the Caribbean, for example, as treatment under the and HIV under the magnificent. Please.
I will be referring today to challenges to combination HIV prevention in the context of a pandemic in Latin America and the Caribbean. This is based on combination HIV prevention. It's necessary to consider the three pillars. Just dealing with or addressing the biomedical pillar, having policies and services, is not enough to be able to put an end to the new infections. It's necessary to mention the structural component, discrimination, policies within human rights framework, and that's important for the behavioral aspect for the individual, where he chooses freely based on formation and education. Within the biomedical component, I wanted to highlight that besides antiretroviral treatment like TAR or multi-month delivery will not be dealt with today. Talking about some aspects of the epidemiological aspect of HIV infection, the new infections show a descending curve, but in Latin America, the new infections between 2010 and now, in the Caribbean, the reduction is even higher, but less than at a global level. So we are a little behind in all this. We're falling behind. We can talk about the antiretroviral treatment led by Latin America and Caribbean at a global level. But currently, the data from 2020 show how globally 73% of people with HIV had ART treatment, but less than 70% of people within the region were receiving antiretroviral treatment. One of the aspects of the impact of COVID is seen in the results of the Pulse survey that was done by the World Health Organization. What happened with the essential services for transmissible disease. Here are the ones with greater interruption, diagnosis and treatment of tuberculosis, followed by services of prevention for HIV. Also were impacted clearly the services of testing for HIV and treatment, antiretroviral treatment. Basically, the testing, screening, and diagnosis of HIV, we can see that since 2019 to 2020, there was a reduction of 34% in the number of HIV testing in Latin America and Caribbean. This has to do with 20 countries in the area at Latin America and Caribbean. Clearly, the reduction in screening that is also observed in a reduction in screening that had a lesser reduction, but 27% in a reduction of coverage of testing in pregnant women. This also has an impact in a reduction of the diagnosis of people with HIV. And this between 2019 2020, the reduction was 27% in the number of tests with positive results in our region, our area. As far as PrEP, a tool or an option additional for prevention, people with at high risk of HIV as part of this combination HIV prevention. This is going slow. The recommendation for WHO in 2015 and 2017, there was one country with PrEP implemented as a policy, as a health policy. In 2019, there were 8 countries implemented PrEP as a policy. And currently in 2021, we have 10 countries that have adopted PrEP as a health policy to prevent HIV. There are more countries offering PrEP as part of projects or are planning policies or projects. But in spite of seeing a growth, the growth is very slow. As to the number of people that receive PrEP in Latin America and Caribbean, we have seen a growth in 2019 to 2020 of 19,700 people in PrEP to 34,000 in PrEP. We have the data the first semester 2021, but they are not complete. It's just 10 countries have reported their information to us. So most of the people in PrEP in this region come from Nasir. That's we can see in 2020 there were 23,000 in Brazil, followed by Haiti. So the coverage of PrEP and the offering of PrEP in the region is at levels that are insufficient to respond to the need. Regarding PEP, policies also have an impact here. Countries of the region offer PEP, which is post-exposure prophylaxis. This is also a very good entry to receive services to prevent HIV, and it's recommended when there's professional exposure, occupational, let's say, case of rapes or sexual assault, but it's also recommended for exposures due to consensual sexual relationships. This is where we have the biggest gap. Only half of the countries reported, 27 out of 33 countries offer PEP in the case of exposure due to consensual sexual relationship. During the COVID pandemic last year, out of these 17, 6 countries indicated that these services were discontinued due to the pandemic. More strategies for combined prevention. This is self-testing and assisted notification, HIV partner notification. This is part of an additional approach as testing biomedical components for prevention. We have seen that countries also are very cautiously increasing incorporating these strategies. Self-testing in 2019, there were only 2 countries that had adopted it as a national policy, Brazil and the United States. In 2020, a total of 7 countries were added. So also due to COVID pandemic. And as to assisted HIV partner notification, there's 3 countries that are offering this, 17 countries. What we see here are strategies that are recommended, and we know that they're effective. And in response to HIV, we still have a very slow incorporation as a package to respond to HIV. Condoms are still an important tool in preventing HIV. During these years of pandemic, the median or average distribution of condoms have reduced 27%. If we look to the right, the image, one country to country, the number of condoms, the percentage change of distribution of condoms, one country to another, 2019 to 2020, we can see that in every country except one, there was a reduction in the distribution of the number of condoms. What we see here are the aggregate values and the prevention cascade of HIV in Latin America that developed these cascades in 2019. In the first pillar, we see the total of population estimated, or HSH, M2M, and MSM with zero, separated by zero status, and we see that the negative MSM had been screened with HIV tests in the past 12 months. However, only 17% of those estimated had been linked to these, so they had received a series of services that were more comprehensive based on their needs, and only 12,000, so 6% of the total, had continued follow up in 12 months. So they had gone back within 12 months to get another test, another screening test for HIV. The recommendation of WHO for this population is to have HIV testing between 6 to 12 months, maximum 12 months. So something is wrong in this sense. Out of these 12,000 people, or 2% or 2.3% were positive when previously these people had been negative. So this kind of analysis allows us to see what the reach is for our services. 40% in the past 12 months is not bad, but the coverage of services of higher quality, comprehensive, and follow-up of these shows larger gaps, and we have important gaps in the impact of these services, as we see here, unfortunately, people who were negative and now are positive. For sex workers, we see results here indicating a similar outlook. As to stigma and discrimination, we see that unfortunately a very high number of people, of key populations, avoid going to health services to get health services. Here we see MSM and others who sex workers who did not go in the past 12 months, 50-60%, almost 30% of the sex workers in Barbados, close to 47% of sex workers in Dominican Republic avoided going to health services for aspects related to stigma, discrimination, and treatment in those sites. We see also how people who were denied health services in the past 12 months, transgender women, MSM, or sex workers, or HIV. The very few countries that have information. This information is essential to be able to monitor. One of the elements to be able to monitor the actions in reduction of stigma and discrimination in health services. Almost at the end now, we see that during this COVID era, there have been important improvements in essential services, redirection for mitigation programs, providing antiretrovirals, dispensing multi-month retrovirals, and also there were opportunities. In spite of the fact that there was a self-testing, that we saw that more countries had incorporated self-testing as a national policy, and I already mentioned the multi-month antiretroviral dispensing, monitoring, virtual monitoring to adherence, delivery of medications to the homes of the users through actions with the community, appointments online, telemedicine. Conclusions, we have to consider the trend in the epidemic, HIV epidemic, very favorable. The COVID pandemic has been a big setback in many levels and at the level of response. HIV, however, we've also seen some opportunities that are necessary to keep up and enlarge, expand. It's important to take into account the new paradigm for HIV prevention using comprehensive policies for prevention to see the person and all the needs they have. And also, policies have to be aligned with international recommendations. Before the COVID pandemic, we still had a huge debt towards response to prevent HIV. COVID pandemic has been a big blow, but we have to catch up on lost time, and here's one of the guidelines that are necessary to be able to do it. It's also very important to have methods and analysis like the prevention cascade, and it's important to approach stigma and discrimination. So one of the essential issues is to ensure participation and with the key populations and those affected by HIV. Thank you very much. There's my email address. If you need to get into touch with me, I'm at your disposal.
Muchísimas gracias, doctora Alonso.
Thank you very much, Dr. Alonso. We have the panel on. I would like to now welcome Alessandra Ramos Maqueda. She's joining our panel. She is interpreter and translator from English into Portuguese. She has been working on law for the rights of trans people for 30 years, and she is the president of Transformar Institute. She's a member of Brazilian Coalition for Rights and the Latin American Caribbean Network and Afro-Latin Network. And this was the reason why we met Alessandra. She's the coordination of community involvement of IMPREP study in Brazil. Welcome. Also, the panel welcomes Cesar Galindo from Guatemala. Cesar Galindo Arandi works for over 30 years in HIV on projects targeted to key populations in the context of higher risk in 5 Central American countries. Also, in the implementation of Sentinel Vigilance of CTS, he has participated in the preparation of national guidelines for the attention and prevention of HIV in the region, in the Central American region. Welcome, Cesar, and thank you for being here with us today. Also, welcome, Dr. Alonso, and thank you very much for your presentation. So much information. I believe this will guide this panel. I would like to start by thanking you in this context, the challenging context presented by Dr. Alonso, with significant percentages of reduction of care. What should we do in immediate term to change this situation? Alessandra, please.
Vocês estão me ouvindo? Sim, então, eu tenho pensado aqui, no caso do Brasil, a gente foi extremamente afetado por conta da pandemia em graus diferentes, porque o Brasil tem uma região continental, e a gente conseguiu manter os serviços de telemedicina, que é uma boa notícia. A gente tem uma rede ampliada de serviços, a gente está ampliando o serviço à PrEP, que são o acesso à PrEP para a população, que são importantes, mas outras
barreiras. We have an expanded network, we have access to the population. It is important, but there are other structural barriers that prevent access to a poorer population, to Black population, and also, especially, access to the population of those people who, in Latin America, we have a problem that is trans population. This is not just a question of trans people. It's all the population, all trans population, because this is relationships, sexual relationships, all the population involved has difficulties to access health services in general, but also the more targeted group, the group more targeted to this sector, well, we still see something to be solved in America, that is social barriers, discrimination, things related to legal issues, the name. This has affected a lot to younger populations, LGBTI here in Brazil. Barriers of legislation also, and we have legislations, but this has to do with legislation for white population, different from younger or poorer populations. Usually it's black population, LGBT population. They are the ones that are most affected. We can hear you. One of the most important aspects in the middle of the pandemics has been the capacity to be able to move. And this interaction that took place in some countries, precisely with the governments to respond, is what happened. What Monica said, this is an opportunity on the community models that had a lot of importance last year. But as long as countries adapt to the situation of current pandemic, they are coming back to the previous models, unfortunately. But this capacity that the communities had to respond and to take the drugs to the further or distant locations, this has been very important. But another important aspect is delivery and also prevention programs, being able to favor access to tests, being able to send drugs to people, guarantee the supply of condoms, and to a certain extent also because of a question of access that Javier mentioned at some point is telemedicine. Telemedicine was able to cope up with the needs that people had. For example, in Guatemala, in the context of men having sex with men, the index rates are very high population, and management has been quite a permanent challenge due to lack of response, sometimes from the authorities and the services that have been limited because of COVID, and they were not able to be to receive medical support, and probably this has had a good impact. Some organizations that work in the region were able to provide the services, but in a limited way because of the time restriction, closures of the countries, and also lack of resources. Universal service is also a permanent challenge. This means also an expense to provide resources to organizations. Many organizations in the region, in the context of Guatemala, they tried to serve their population, and a week later they had to close because there was a group that had to close because of COVID, because of lack of supplies, lack of response, lack of counseling or advice or technical support to efficiently manage biosafety. But I believe that we had to adapt, and we can work now, as Monica well said, and this struck my attention because in a consistent way in Latin America, diagnosis was reduced around 35 to 40% in some countries. We see this in official reports. Many actions were implemented, and we need to continue with that. Thank you. Thank you, Cesar. And now I will concentrate on one of the comments that you made about the involvement and community services, to go back to Alessandra and ask her to comment on what the situation was in Brazil, how community services responded to the lack of provision of services by the government. Please activate your microphone.
A gente vive uma situação complexa no Brasil.
We live in a complicated situation in Brazil. In 2017, because we had a presidential election, the president is a negationist. He denies the situation. He has a certain negative attitude towards it. He has an attitude to go against the population. For example, the Ministry of Health, and the information was directly targeted to key population material was interrupted. They would not. Many images were removed. Many messages were removed. There was some information about men having sex with men, infections. All that was removed from the press, and especially I would like to say that services were limited because of lack of physician to work on this, but the community network was kept. Community network among us did work, but we had to look for support, to look for help. And this has been discussed already. We had to look for help. We had to look for support. There was no planning for vulnerable populations, HIV, COVID services, and telemedicine was positive, I should say, but we had some difficulties depending on the place, which place in Brazil they would be found. There was lack of medicine and also some interruption because of fear. But it's important to say that these measures are not enough. A great part of the population in Brazil, they don't have internet, they don't have social distancing that is required. They live in shanty towns in extreme poverty, and we have a complicated situation. So we have some cases that are very serious because of the different barriers. There are structural barriers by now, mainly because of the economic situation. 23% based on research, 23%. I was saying, based on national research of infectology in Rio de Janeiro, found that 23% more of the population of LGBT has suffered compared to the general population as to the difficulties, economic difficulties, being able to work or being able to have health services. Thank you very much, Alessandra, for telling us about your experience from Brazil. The data that we saw in the presentation by Dr. Alonso was quite sad. Our region has gone back a lot as regards prevention, and as was mentioned in the previous session, even some countries are reducing for the next year their budget as to what is HIV response. What can we say here? What can we state or propose for the coming months, for a short time, for a near future, to respond and to take back the course of HIV response? Let me start with Dr. Alonso. Thank you. Well, I have been thinking about the topic that you mentioned about the assessment of funds or the availability of funds. Evidently, one of the logics is to ask for more funds. However, we have to look for strategies. We have to be more efficient and more effective. Also, we have to get on the truck that has the fuel. What I mean by this is integration at service level and also at civil society level. Civil society, HIV, hepatitis, tuberculosis. More integrated, we will be able to have a more impacting action and a more efficient action. Also, in order to be more efficient, governments will need to look for strategies, partnership together with the communities. This is absolutely clear, and something that we have not shown, but with pleasure I can share some data. The cascades of prevention, we can deaggregate them. We can divide them between services offered by the communities and services offered by the institutions. The ones by the communities have a higher impact. And this is something that was pending before, even in the past. But if we want to be more efficient in this new scenario, this is one of the measures that we have to consider. I give the floor to you. Thank you. A great task, a great activity to link civil society and the state and the government. Cesar, please, we will listen to you now. Thank you very much. I believe that in line with what Monica was saying and the experience that we live in Guatemala during the lockout, the great thing that happened here was the integration of just one speech, unified speech of all the institutions. This has not been seen in Guatemala in the last year. All populations gathered in one joint speech. We thought about the welfare of all the communities. This was very important because we lived a process that had not been lived since in the 90s, when all communities were expressing themselves. And I think this is very important, but we also have to add that data that Monica is presenting. This is very important. If we have the data presented by Monica about the populations as to prevention services, this is minimum. And what is being said is very important in all the contexts. This is not a problem with economics. This has to do with the emphasis on the cascading of prevention that is giving us many messages. And something true, some true that Alejandra was saying is we are not stopping no changes in the new infections. We have to work on that. And I believe that in front of a different aspect, we also need to mention what Monica was saying about the role of the communities in Guatemala. In 70% success, and the impact is huge. And this has their scope to have people who are in a difficult situation, well, to be able to reach them also. Thank you very much, Alessandra, for providing us this important information to keep strengthening the capacities from the organizations as well. I would like to go back on stigma and discrimination, the one that is gathering us all today. And I want to appeal to the experience that you three have, Alexandra in Brazil, Cesar in Guatemala. And I would like to ask you, how you perceive from your experience the impact on stigma and discrimination. Cesar, please. Thank you very much. Well, the first aspect of stigma is oriented to the fact that usually we point at the people who are trying to have sex without condom. They are promiscuous people, people who live with HIV, or it will generate a bigger impact as to the state resources or the state-owned resources because of lack of drugs, because it's an expensive drug. Dealing with these situations with the communities, this has to be approached with. And a study that we organized with the university is that many people had difficulties, faced difficulties because of the fear for stigma that they had. On the other hand, we were facing service providers whose it was very hard for them to understand the situation. It has been quite a big challenge throughout the years. For example, in the context of Guatemala, where at the beginning the organizations had difficulties because no organization of key organizations were not providing any support. The Ministry of Health was not providing any support either. It has been a process of work of a long time, many years. UNAIDS, they were the ones who positioned on the side of the organizations that were proposing this. If you allow me, these gaps have been closed little by little, but today, in the context of Guatemala and other countries in Central America, we are preparing our policies. El Salvador is working well, Honduras is working well, the same as Honduras and Panama. We can see an expansion in Central America for the next year. This will be a determining factor and it will be led by us. But essentially, we need also a strategy by public policies. An important aspect in Guatemala is that right now, women have support in the country. There's 2 clinics that are giving support and they're providing sexual work, women sexual workers. Also, they're providing services. Thank you. Thank you, Cesar. Alessandra, please, I would like to also motivate or know if there has been any impact to reduce the stigma and discrimination towards sexual diversity or people who live with HIV. Here in Brazil,
pouca resistência.
PrEP was implemented with little resistance, but there is some fear, some initial fear, panic of PrEP. But some research shows that the predisposition to take PrEP is after you have had the information on what this means. This is a big interest. There is a big interest. Here we have a network that is the expansion of the PrEP service and think this is very good. And now we had expansion for complementary supplementary health, paid health services here in Brazil. Health professionals can prescribe PrEP and also nurses who can even prescribe PrEP in Brazil. So we believe this will be essential because many times the medical community has some aspects, some issues believing that PrEP is less important than TAR services or retroviral services for people who live with HIV/AIDS. So it is important that we can expand the service because we need to reach to other populations that are not reached. Black population, peripheral population, and trans people. Thank you very much, Alessandra. Thank you very much. You all for joining this session and motivating this discussion. We have some pending activities to go back to HIV response that has been so much affected in the last 18 months. Now, we'll start with a closing session. Thank you very much again.
Hola, bueno, Buenas tardes con todas, con todos y
Hello,
con todos.
well, good afternoon to everyone.
Queremos agradecer a
We
todos.
have reached the end, and we want to thank all the participants for on all the panels because it is way beyond the expectations we had as to knowledge and passion, and all these who are present here. Okay, next one. Of course, I want to remind you, as we mentioned in the beginning, we would value your feedback. So we're asking all those participants in this forum to complete. You're going to receive a link to complete a post-meeting survey to continue improving these forums, and that way you will also receive a certificate of attendance to this forum. All this, of course, will be sent by email, and the incentive to complete our survey is, to receive the certificate attendance is that you have to complete the post-meeting survey. I want to point out again that I am so grateful to Lara and Elise, who are the ones who made possible this meeting with a super intense work. And to Marco and me, it's been an honor to be with you. And thank you to Viroli Education and all of you to be sitting here for 3 hours and sharing this forum on stigma and discrimination. Hopefully next year we can organize an event and see the results. Thank you to all of you.